So Dr. Banzer asked me to tell the story of Terrell Owens. He is a wide receiver in American football. He runs and he catches passes. He has to be very fast and very agile. And he was injured on a Sunday, December 19th. He avulsed the deltoid ligament in his ankle, and he shredded the interosseous ligament that holds the tibia and fibula together, and he had an open spiral fracture in the fibula. This was a career-ending injury. They treated him immediately after the fracture with microcurrent with a unit that he owned, and he had surgery on Tuesday where they put a plate and screws to hold the tibia and the fibula together. They put the deltoid in place, but they don't even suture it. They just put it in place. They don't worry about it. So they called me on Monday morning and said he wanted to play in the Super Bowl in 6 weeks. And I did the math in my head, and they said, his doctor says you have to be the one to treat him because it's too scary. Great. So I got on a plane, and I flew overnight, and when he got out of the operating room, we put him in a limousine, laying on the bench, and we put the microcurrent on him for the 1-hour trip home, and we started with the frequencies to stop the bleeding. And we treated for 24 hours, from 8 o'clock in the morning on Tuesday until actually 10 o'clock in the morning on Wednesday. At 10 o'clock, so I slept on the couch sitting up. He slept on the couch laying down. At 10 o'clock in the morning, the team trainer came to the house and said, okay, let's see it. So we opened up the boot and we took off the bandage. And we looked at the foot that was injured. There was 0 swelling, 0 bruising. And I make this gesture because we looked at the other ankle, and they looked identical. You, aside from being able to see the stitches, you couldn't tell which foot was injured. So the trainer said, how do I take advantage of what you can do? And my response was, you have to believe what you see instead of what you expect to see, because I've never done anything like this before. So we treated him 24 hours, and then another 6 hours, and then 4 to 5 hours every day. And the team trainer was good to his word. 3 days after the surgery, he was in a swimming pool, this deep in water, with a bag, a Ziploc bag over his leg, running on a treadmill in the water to reduce the impact. Day 3, 4, 5. I arrived on day 6, Monday, and this is what I saw. Terrell and his girlfriend were having a snowball fight in the front yard. He was wearing sneakers, running shoes, right? Trainers, in the snow, 6 days after surgery, chasing his girlfriend, throwing snowballs. So they started proprioceptive training. The surgeons said we were crazy. It would take 13 to 18 weeks or maybe never, and the Super Bowl dream was silly. At 4 weeks, Burkholder, the trainer, did fluoroscopy, movement x-rays, and ultrasound, and x-rays. The fracture was completely healed in 4 weeks, and the ankle, including the deltoid, was completely stable in 4 weeks. That's not possible. So at week 4, we started thinning out the fibrosis, making the tissue softer by taking out some of the calcium influx. But I was afraid to take out the scar tissue until just before the Super Bowl. So we got to the Super Bowl, he got there on Tuesday, and he couldn't run. I got there on Wednesday, like he ran 20 yards and his leg spasmed. I got there on Wednesday, his massage therapist got there on Wednesday, and we worked for 5 hours taking apart the scar tissue in his leg down to the bone. Adhesions in the nerve, the blood vessels, the bone, the fascia, the ligaments, the tendons, clear down to the toes, from his knee to his toes. The massage therapist, Brian, describes it like bloodless surgery, what you see in, South America. It just dissolved. So he played in the Super Bowl 6 weeks after the injury and ran for 157 yards, which is a lot in a football game. And the recovery was judged impossible. When he was elected to the Hall of Fame in 2018, he thanked the FSM Dream Team for his recovery. So that's just a story. It's an impossible story, but it's a story.